I want to follow up on some of your earlier testimony to Senator Ward and to Senator Martin. So we have the options program, 4,150 seniors on the options waiting list. $8.1 million is going to take about 1,700 of those off of that list. You testified that we have a growing senior population, and we're seeing that Medicaid reimbursement rates are not able to cover the care that they need. So as our senior population is growing, we're seeing a reduction in the number of beds, whether it's personal care homes, at-home care, nursing care homes. So the governor is once again proposing a minimum wage increase to up to $15 an hour. Looking at all of those things that you testified to, the nursing homes, the personal care homes, the home care providers who've all told me that an increase to the minimum wage would be detrimental to them, that they're struggling to provide the care at the rate of reimbursement that they're getting now, and then raise their cost of salaries and wages. These providers are obviously, they're regulated under different departments, but the people that they all serve are under your purview. So how many seniors will be impacted by the fact that there's already a shortage of beds and providers? And how exactly are you going to address an even greater burden on that number with an increase to the minimum wage that's going to increase costs? And I've gone through the budget. Maybe I missed it, but I don't see any increase in reimbursement rates for these types of care for our seniors. So I think it could potentially make things a greater crisis, a greater shortage, and a problem for the growing number of seniors in our Commonwealth.
Yeah, I can't speak to the reimbursement rates that are responsibility of Department of Human Services. You know, based on the blueprint that the Long-Term Care Council issued on direct care workforce, part of what they were recognizing is that we do have a crisis. We have a huge shortage on direct care workers that are needed to support older adults. Some of the statistics that I gave earlier with the fact that wages are low, and you know, with 20% making less than federal poverty, 50 less than 200%, 45 getting some form of government assistance. So if the minimum wage increases, some of those that are on government assistance come off, and that you should realize some savings there.
And I understand that assumption, but I think we also recognize that when we raise the wages of the lower paid workers, that there's a compression issue. And so that's going to force a lot of employers to have to face some really difficult challenges. You know, is this something that your department's going to be prepared to handle?
Well, it's something that needs to be considered. The area agencies on aging, I don't have an analysis in terms of what the implications are, because I don't, you know, they contract out for services, and I don't know what the direct labor rates are.
The impact of a minimum wage increase on nursing home, personal care homes, and in-home care has not been addressed,
Well,
to your knowledge.
to yeah.
Look,
My understanding. Go ahead. My understanding is, with the exception of perhaps some of the support staff, the minimum wage, so starting at $12 an hour, most are paying that or above. So the percentage of individuals that would be impacted.
So what you're testifying to then is that there are not that many people who are making minimum wage in nursing homes, personal care homes, and at in-home care.
I don't have those specific statistics. I know we have
I can say for your concern regarding beds, why they're looking at or using community health choices is it's a waiver to nursing facility, which is not the person's preference. The preference is to age in place, which is a lower cost, more affordable, and preferred by the individual.
And I understand that, but even with an additional $8.1 million, we're only going to be able to take 1,700 people off of the list. So, look, I think that it is incumbent on the department to plan or create a plan, or put one in place to handle not only the influx of more seniors into the system, but also assure that they can receive the quality care that they need and deserve. So, thank you, Mr. Chairman.